Hi everyone. In today's experience exchange, we have a very interesting session with Dr. Ria.
We did lose the competition, but I definitely won that day because, this hackathon was actually one of the first events that sort of catapulted me into the realm of research. So, this is going to happen for sure. Like, you're going to have this irrespective of anything. Like, nothing could go wrong.
After this entire journey, I'm sure that there are certain things that you've understood that are the highlight of your CV or your
Yeah.
resume, right?
Yeah.
And that's probably the reason that you got into.
Because once you're in it, you're invested in it. It's a lot of investment.
Do you enjoy learning without distractions? Download our app now.
Hi everyone. In today's experience exchange, we have a very interesting session with Dr. Ria. I have a long list of questions to ask her, especially because we have worked together. I've seen her get through final year of college, then I've seen her get through internship, and the way her mind has shifted all across these years. And finally, she's got into Boston University and she's going to now pursue her MPH. This conversation is going to be something very close to my heart, especially because um, I've seen her, but with that, I've also seen her network with a lot of people. So she's decided not just based on what she wants, but understanding the prospects of different areas of dentistry, and then she's chosen to make a decision where her strengths lie. So this conversation, if has to help somebody, is mainly because I personally feel that speaking to a lot of people really changes your mindset, and she has utilized the effect of networking and has now chosen a course for herself. So, thank you so much for accepting to come here today and share your journey. I'm really excited for this conversation.
Thank you so much, Dr. Palak. It's really nice doing this for you. And I just really want to explain this entire process and how exciting it is. And I hope I can help out a lot of people and clear a lot of concepts to them with this session.
Yes.
Yes.
So I have my first question for you, which is
Yeah.
you decided to take up MPH, and there might be a series of things that happened, right? Like, what did you do in your final year? Were you somebody who liked clinicals, or you just hated clinicals, which is why you're doing MPH? What's like the background of why you're doing what you're doing?
Okay. So I think I'll just dial back down to like from the beginning of my BDS journey. So healthcare as a field, right, has always piqued my interest, and it kind of explains as to why I did dentistry in the first place. And dentistry is a very big part of the health industry, correct?
Correct.
So while I was studying at MCODs, I was introduced to a lot of research projects right from the beginning. The concept of research was something that I was unfamiliar with before I entered college. But when I did, I actually owe it to one of my seniors who introduced me to a hackathon that was conducted in MCOT's Manipal, actually. And, a hackathon is like a competition wherein you make, sustainable, feasible products or like come up with ideas that actually resolve, public health issues. Yeah. And since I was in a dental college, this was a dental hackathon. So I had to resolve a lot of dental issues. And naturally, we basically had a team and we made a prototype for a budget-friendly and eco-friendly computer-controlled local anesthetic device. And this was all guided by our oral surgery professor. And we had like two engineering students from MIT. So all of it was done really, well. And then we presented and everything. So just the process of all of it, like being able to, get to be a part of something that would contribute in making, the lives of a community much better was something that really, really, excited me, and I thoroughly enjoyed the whole process. So we did lose the competition, but I definitely won that day because, this hackathon was actually one of the first events that sort of catapulted me into the realm of research. So as and when the years passed on, I took up a lot of research projects in multiple aspects of health, not just dental health, like it was public health dentistry, and then it was oral surgery and endodontics and just too many things. And I just really loved, how different each health problem is and how different the solutions are to it. So I think that was one of the reasons why I was very intrigued by public health and research. And today I've been part of multiple research projects in various aspects. I have publications as well. And after that, I think I pretty much networked with a lot of people through this process who are much older and much more knowledgeable about public health. And they told me about this degree that, since you're so interested in this and it just looks like an MPH degree, something that would fit for you. And I was like, okay, let's, read up about what this is. And then I did that. And I think it did align with my goals. And pursuing it in Boston University is actually something that was not my initial plan. I looked at a lot of other universities before, but then what I realized is that Boston is actually a healthcare hub. Okay. So it offers you, a lot of opportunities to maybe create an impact and give back to the community. And it's like so close to all these big league headquarters, like UNESCO and WHO, like they're right there, very close to Boston. And it's also a student hub. So I really liked the fact that, a student town is somewhere that I've already done my undergrad in. So a student town for my postgrad would be like really good too, because it's familiar territory. And another reason why I took Boston was also because I got a Hefty scholarship from them.
Okay.
And financially, I think any master's degree is, a big financial investment. So something that alleviates your financial burdens is definitely a plus. And Boston scholarships was something that aided in my, benefit. So another reason is because the last and the most important reason as to why I picked BU for MPH is one of our MCOT's professor, okay, the HOD of Public Health Dentistry, Dr. Rajesh. So he's actually done the same course that I'm going for. And he did
Oh,
it he just did a few years before I'm going to do it. And he told me his experience at BU. And after listening to that, it just made MPH at BU a must do. So this is why I've decided to, do it. This is my story.
it's really exciting. In fact, to say that research is a starting point, but hackathon is something that's like, something that you do out of innovation and you want to do something new. And so you mixed up like research, innovation, put it together, you experimented a lot of things, and finally you got to realize that, hey, this is what I like and I can pursue something on those lines.
Yeah.
So I want to know from you that, how did you even start your research? Like a lot of people do not know that they can do this in undergraduation, but you
Yeah.
have a lot of publications already under your name. So how did you start, and what did you keep yourself motivated to continue to do it?
So like I've mentioned that networking is a very important aspect in all of this, because had I not spoken to my seniors, I would have never been introduced to, research as a concept. Like I had no idea about what or how important a research project would be for a dental student or a medical student, in fact. And I think speaking to them, and then, they just basically told me that, we have Mahe SRF and you should really look into it. So I went and I spoke to Ravi Kiran. So he was the head of the Mahe SRF team. And then I spoke to him and he guided me about what research is, what the different kinds of research, and how I can break it down to. And then he told me how important a guide is. So I obviously picked Dr. Srikanth sir as my guide because he was one of my favorite professors. Like nobody teaches DADS like him. And in first year itself, I approached him, and
Okay.
yeah, and that's like basically just the gist of it. Like the staff and the students at MCODs really, really help you out if you really just go and ask. Like ask and you shall receive is all I'm gonna say. So that's how I basically got into research. And I think MCODs is also very big on research events. They organize ton of research events. They have a really good record also in publications, and they're just very pro research. So that's something that I think I was very lucky to have, and not a lot of people really have those kinds of resources that MCOTs gave you. So,
So, what was your first research all about, and how was your experience doing it?
so my first research project was actually with Dr. Srikanth sir, and it was in forensic odontology.
Okay.
So this is something that really, really interested me. It basically was an international study. So we did it on a Nepalese population. And
Okay.
we basically had to use this, software called EDMA, Euclidean Distance Matrix Analysis. So it's a mathematical equation. What we do is we utilize that mathematical equation, and we basically understand the different arch width and arch sizes of male and female Nepalese people. And then we
Okay.
compare it to see how different it is for the males and for the females, and why they have these changes. So is it a genetic factor, or is it because of different regions, or what it is that causes it? So we use this unique method in order to find out the different morphologies of arch variation. And yeah, and it was
And that's
something
all happening in first year of
in first
BDS,
year.
right?
Yeah, and this was a very long. Okay, I'll tell you one more thing, that research is a very, you need a lot of patience to do research, because it's not like, let's do it today and like tomorrow we're done with it. That's not how it goes. You need to have a very, very patient, behavior. You need to be very, very, smart about all the things that you do also. It's very crucial. Everything is very delicate when it comes to this. Like you cannot make mistake. There's no room for error in research. And if you do the error, of course, you have to redo everything. So you need precision, just like in dentistry. So that's something that I learned. I learned a lot of things working with Sir, and I did have a research partner. So I really thought that it would be better if I worked with someone, since I was just in first year. So I
Okay.
was paired up with another first year,
Okay.
who's her name is Simran Gupta. She was our overall achiever student. She was the topper of our college at that time from my batch. And yeah, so I got to learn a lot from her as well. So teamwork is something that I built doing this, which is also a very important skill that you need when you pursue MPH, by the way.
Okay.
Teamwork, leadership, all of these things are very crucial. And I think that's what I learned with Sir, with Simran, and doing this research project. Then I
So,
actually
how long did this first project take?
So we had COVID happen in like towards my second year mid,
Hmm.
and that just put like a halt on the work, because it was a healthcare crisis situation, right? So I think that's when everything went online, and we all went back home, and we
Correct.
couldn't work out from the lab, which was very important for our research, because we needed casts of people to analyze and assess. But somehow, Sir just said that I'll send you all the photographs of these casts. Let's just keep working on it. So we worked throughout COVID as well. While we were
Okay.
at home, we did everything that we could. And after that, like by the time COVID ended and we came back during my third year, we were done with our entire research work. Like
Okay.
the groundwork was done, and we just wrote our manuscript, and then it got published. So before I was done with college, I had my publication.
So it
Had COVID not been there, it would have probably been sooner.
Yeah, but it actually took you like an entire degree to do one research. So I'm sure it demands that amount of
It
resilience
does.
also.
It really does. So yeah.
And that support, I mean, it's just
Oh
not
yeah.
easy to.
It's very, you feel blessed when you have the proper guide and the proper, research partner. Like, I think it's very important to have someone who thinks in a very similar way for the research project as you do. And for example, if my research partner was someone who did not care about it as much as I did, we would have probably had a bigger lag period. We wouldn't have probably done it during lockdown as well. And
Correct.
Sir was just so dedicated to like do this because he believed in me and Simran in doing this, and that was something that just motivated me a lot more to do this.
Correct.
So yeah,
So, how are you as a student, in the sense that I know that you were a good student and stuff like that, but what basically there's a mind shift that happens, right? So you can
yeah,
be very good at your clinicals, but then you
right,
have to choose between clinical and non-clinical.
right.
So what was that turning point for you when you were like, okay, now I can focus more on research and this is what I want to pursue for the rest of my life?
Okay, so I was really good at clinical work as well. I like both. I like clinical as well as non-clinical. So if someone asked me to choose, I was like in a tongue tie as to like what do I say, because I love both equally. But the thing is, what people don't understand is that when you are working as a dentist, okay, you have like protocol, a set of things that you do. A patient comes in, you talk to the patient. When you sit down the patient, you talk to them, you take case history, then you go about with examination and differential diagnosis, and then a treatment plan. Correct.
Correct.
So, but this is what a dentist does for an individual. It's very personalized. What I realize is with in a non-clinical field such as an MPH degree, you do the exact same things, but you do it for a bigger population. So it's a global impact that you're actually creating, minus the whole examination. Obviously, you have a different set of protocols there, but all ultimately at the same goal: to help
Hmm.
people and to create a better, a cleaner, a better opportunity for people to live in a good society with lesser health disparities and more better health, benefits is what I'd say. So I had an option of doing this either on a personalized individual level or a global population level, and I think I would rather make a bigger impact than just be restrained to a very limited one. So
So you
that
chose.
yeah, so that was one of the reasons also as to why I so I mean it's the same thing, but you're doing it for a bigger population.
Correct.
So it's a lot more responsibility, a lot more work. But the ultimate goal is the same.
Yeah, that really changes perspective. I mean,
Yeah.
non-clinical is not looked at in that way.
Yeah.
And I feel that if you have this sort of perspective right after BDS, I think half your game is sorted, because it's just the mindset that you go into that degree with, right?
For sure. But I think I had this mindset throughout my degree as well. I think what, actually got me to think of it this way is, the different kinds of opportunities that MCOTs did offer me. Like, had I not been involved in so many things, like, for example, when I also was working with Medi Study Go, right? Had I not got that opportunity of being a script writer and also working with social media, I wouldn't have realized that, what, I actually like doing these things as well, that I'm learning something new over here as well. And it's actually impacting a different set of people because Medi Study Go is an edutech company, right? So that's different from healthcare, but it's also a part of it. It's like a
Correct.
small part. It's the educational part of it. So, you see, everyone plays a very vital role in
Hmm.
basically aiming at, making a very big impact and making things better for people. So I don't think anyone should really look down on non-clinical in any way because everyone is contributing in doing something for the good of people, for the betterment of people. So I think this comparison is something that really should be stopped.
So I
Yeah.
agree. I 100% agree, because clinical wouldn't have agreed.
Yeah.
Clinical wouldn't have been there without non-clinical, right?
Exactly.
So,
Exactly. And you do learn a lot of non-clinical stuff as a clinical dentist as well. If you think about it, like Okay, so there's this thing that I did when I was in my internship year. I actually got the opportunity of, interning at a private practice outside of
Okay.
college. So I used to do that for a few months. I used to do that after my college hours were done. So I used to work in the hospital until like a certain time. And then every day for a few hours, I would go to this private practice and I learned about practice management. Okay. So working in a clinic and working in a hospital, two different concepts, like very, very, very different. And not only do you learn about clinical, treatments and clinical methods, you also really, really realize the importance of administration and how everything has to be managed. Like you cannot just be like, okay, the patient's going to come and I'm just going to do the treatment. Like I'm going to do the examination and then treatment and then I'm going to send the patient off. No, you need to take an appointment for the patient. You need to know that this patient would come at this time. You need to, talk up the patient about the different kinds of procedures you have because you use different materials. So all of this is non-clinical. This is not part of clinical, but it's equally important. Because had you not like explained the patient about materials, for example, ceramics in terms of aesthetics, right? Or implants. You use a lot of different materials in implants. Had you not talked to them about the different kinds of materials and costs, they would not really want to come for treatment, right? So, what's the point of your clinical skill if you aren't very skilled in your non-clinical aspect?
Right.
So
It's a
that's
balance. Yeah.
yeah, it's a balance between both. I feel so. Nobody is like better than the other. I think both equally play a very important role, and this is something I learned while working at a hospital and while working at a clinic. So that also kind of added to like, change my perspective about non-clinical. I kid you not, there were many people who said that, why are you going to pursue a non-clinical degree when, you are already in this field doing clinical? But then like, these are the things that, got me thinking that why not?
Right. So I really understand from your experiences that you've had a diverse set of things. Like
Yeah.
you've done everything that's related to academics.
Yeah.
Research played an important role in culturals, and every opportunity that came your way, you just grabbed it. And
Right.
then eventually understood that okay, this is my strength, this is my weakness. But what was your day like in the sense that there are so many things that as a student you're supposed to do, plus you're not at home, you are
Yeah.
away in
Living
another
alone.
city,
Yeah.
living alone, right? And in fact, I remember once her leg was broken or something and still she was
Yeah.
going to college.
I had a fractured leg.
So I just want to understand from you how, like, if you have to go back in time and change a few things, what were like the biggest lessons that you learned from doing so many things?
So I've always been a jack of all trades. That's just always been me. I think I just like learning a lot. Like I think knowledge doesn't go to waste at all. In fact, it makes you a better person. It makes you a more, you know, better person in terms of like everything. So there isn't anything that I would change because I've always been someone who works according to a plan or a schedule. Like I'm always a person who, wakes up in the morning and the first thing I do is like freshen up and then I sit and I plan my day. Like without a routine, it's impossible to achieve anything. So I was a dental student plus I had to manage my applications for MPH. Plus, I had all these extracurricular things that I had to do
Yeah.
so that my application was better for them. And that is something that is very, very daunting for like an early 20s student who's still in college working and studying and trying to get one degree, also simultaneously applying for another. So, what I learned is one thing. Being on time is always 5 minutes early, correct? They say. So even in terms of achieving something in terms of a degree, you need to be prepared well in advance. So I decided on pursuing this MPH degree like right in the first or second month of my internship. Obviously, everyone during internship is very confused. Like, oh my God, we finally reached internship here. What are we gonna do? We just have this 1 year left. And I think everyone around me was always so chaotic and confused. Some people were just in denial about, it's okay, we have time, we'll figure it out, we have a lot of time. And then before you know it, like the internship was over. But yeah, but I remember I spoke to one of the people who actually applied to MediStudy with me. She used to work with y'all as well, Shruti, right? Yeah. So I was having a conversation with her, and we were all just sitting and talking. And then I was just like, oh my God, what are we going to do? We don't even know what to do and stuff. And then she just says that, it's fine. We have time. We'll figure it out. And that's when I told her that, maybe we should just look at all the options that are out there. And she just told me that, why don't we just talk to seniors, like people who are out of our college, who are alumni now, and see what they've done, And I was like, that's actually not a bad idea. So that's when I actually started networking outside of college. Like that was my phase of leaving everyone from, this Manipal bubble that I have, and like seeing what's actually out there in the real world. And mind you, like everyone should network. It's definitely a skill that you need to attain, but there are a lot of things that you can do to attain the skill. So for me, like I said, because I was a jack of all trades, I did multiple things. I think going for a lot of conferences, attending them, and even presenting papers in them not only allowed me to observe other people's public speaking skills, but also gave me an opportunity to showcase mine. So I think those are the things that I learned that maybe gave me the confidence to go to talk to people without being scared, of approaching them, that I'm going to say something dumb and then they're not going to help me. I never had that kind of mindset because I was confident enough, because I had that kind of practice. And in terms of managing all of that, it is difficult, but I think balance is everything. And like I said, a routine is something you really need to have. Like you'll have people come and say that, "Chal na yaar, it's your internship here. You're not gonna get this back. Let's have some fun." You really need to be strong-willed, and you should be like, "I know my priorities. I will come. We will have fun, but not right now. Like I need to do these things first and get them in order." And then we can go about doing whatever you want. So you need to really learn to say no to people. That's something that's something that I learned in internship, and I wish I had done that much more in the beginning. I did that a lot towards the middle and the end because I had deadlines to approach for my applications, and I think I learned that the hard way. Do not feel bad about saying no to people. Trust me, it's at the end of it, you're gonna achieve your goals and dreams, and those friends and those people are just gonna be right there. They would just be there congratulating you after you've achieved everything. So have a balance, know your priorities, make a checklist of sorts, and after completing each task, just cross them off. And I'm not saying that you just have to constantly keep working. Like you need to have fun as well, but not at the cost of your, goals. That's all. And networking also plays a big role in talking to people, getting to know information. I did all of that. And everything that I've done in my internship here has brought me to this level and made me capable enough to, do this degree. And I think that's also why BUs also selected me, because they really look at you from a holistic approach. They really want a holistic profile. And me, being a part of so many things was something that they were probably really interested in. Had I not done any of those things, I wouldn't have learned any of those skills, and I wouldn't have been where I am today. So that's probably what I'm going to say.
So you speak a lot about networking in conferences, but then, but these people who have already done it aren't in the conferences. Like, do you use LinkedIn or any platform to reach out to people also?
I mean, when I mean to say about speaking to people in conferences, I meant by, the kinds of conferences that you go to matter. So if it's not just, if it's solely a dental conference, then you'll obviously be exposed to people who are dentists or from the medical field. But when I went to I went to an ICSTR conference when I was in my internship, and that just did not include only dental people. It had allied health sciences, it had medicine people, it had professors, it also had public health practitioners. So that was actually one of the conferences where I got to interact with a few public health practitioners in India who did, public health degrees in India. And so I got an overview of how public health is in India. And then they sort of, recommended a few people that I could talk to, and so on and so forth. So, yeah, apart from those conferences, I did obviously make a LinkedIn profile. And yes, LinkedIn is the number one platform to network with like minded people, or with people who have achieved a lot more than you have, or people who are in similar boats as you are. Like I said, networking is important, but networking with the right set of people is also very crucial. And when I was in my internship year, I think I was in a boat where I had to apply. So I have this hard and fast rule. Like there's this mantra of sorts that I really follow, that you in your life need to meet three different kinds of people. You should, okay? One, the first kind of person is someone who's in a similar boat as you are, doing the same process, is so stressed about, oh my God, will I be able to do it? Am I missing something? Is there something I've left out? So someone who's in the same boat as you, so you know that you're not alone. Like there are people who are applying with you, and even they have the same questions. So it's not dumb to ask these questions or find them out. The second kind of person who you really should speak to is someone who's already gone through this process of applying and has reached your destination of like your dream university, doing the same degree that you want to be doing. So when you talk to them, you get an idea of what you're actually getting into. And the third kind of person is someone who's already completed that degree and is out in the real world doing a job, or not doing a job, or like, exploring other options. So then you know what awaits for you after you're done with this degree. So you have a clarity on these things. And then you can make an informed decision. So I did exactly that. And I kept that, mindset, and I networked with those kinds of people. So I spoke to people who are in the same boat as I am, people who are doing the same course that I want to do, but in different universities, but in the United States. And then I spoke to people who are already done with this course and they're working, or, doing other degrees or whatever else that they, have to offer after you do this degree. And then I think research is very important. Research about these things is very important. And that's done through networking. That talking to a student is always the best thing to do.
Best thing to do. Agreed.
Yeah. So that's how I, got to know about everything, like each and everything about MPH that is required from a student's perspective and a working professional's perspective. And
Right.
yeah.
So now that you have so much of information, could you share the application process, in the sense that I know that you knew that you want to do this 1 or 2 months right into internship, but what were the other 10 months like? And then when did you get your results and, the entire process?
Yes. So I'm just going to say it again, that when you apply to any degree, not just an MPH degree, any healthcare degree in the United States, you need to be applying to it 1 year prior. You need to start the entire application process a year prior. So right now, my course will commence in September 2024. I sent out my applications in October 2023.
Right.
Yeah.
Okay.
So it basically took my entire, like 3/4 of my internship went in filling out my applications and applying. Yeah. So there is an application portal for students who specifically want to apply to MPH programs in the United States. It's called SOFAs.
Okay.
And yeah, that's, I think, one of the first steps that a person should do, should create a SOFAs application. And it's a very, very, very straightforward and simple way. You just have to fill in your personal information, your academic information, and then they have individual university requirements. So you shortlist whichever universities you like, and you decide which universities you like by doing research on those universities. The internet is your world. You can really, really use it to your, benefit, and do proper research, find out about universities, make a checklist. For me, the course curriculum was the most important point. Like if the course curriculum was great or it aligned with what I want to do, I used to put a check. And then it's the fees, then it's the location. All of these things really matter. And nobody really tells you this. Everyone's just like, okay, probably good scholarship, good course, I'll just go here. But no, there's like safety, there's money, there's so many things that come into play that you have to, think about. So yeah, So once you're making that checklist and you decide on your university, you shortlist them on SOFAs. Like you just click on the university and they'll give you the application requirements for each university. And it's different for each university. There are some common, documents that you have to submit. The first one being a statement of purpose or a personal statement. Every university will ask you for that. And that is probably one of the most crucial documents that you need to be working on. The second one would be your resume. Every university will ask you for your resume. And some universities offer scholarships. So there are two different kinds of deadlines that you need to keep in mind. There's a priority deadline and there's a final deadline. So I submitted my application well in advance to the priority deadline. And because of that, I was actually applicable for a scholarship. Had I submitted it prior to the priority deadline, but before the final one, I wouldn't have been receiving any scholarship. I would probably get admission, but at the full tuition cost.
And how much is the scholarship? Can I just get a breakdown?
It really depends from university to university. So for Boston University, if you do apply before the priority deadline, they give you a $25,000 scholarship irrespective, but you just got to submit it well in advance to the priority deadline. Additional scholarship is given to you based on your merit. So I received a total of 45% of my tuition.
Wow.
So 45% of my tuition fee is covered by the college itself. And I got $25,000 from the university and an additional like $35,000 because of my merit, because of my scores in undergrad. So you should definitely get good grades in your undergrad, guys, because most of these scholarships are merit based.
Okay. And like, what is the criteria in the sense a distinction, first class? How do they go about grading it?
So the grading system in the United States is different from the grading system in India. We have everything in percentage here, while they have everything in a CGPA form, which is on a scale of 4. So another thing, I was getting to that. So another thing that you have to do while you're applying to your SOFA's portal, you need to get your WES evaluation done. So World Education Services, or WES, is the organization that converts your Indian percentage scores to the US equivalent.
Okay.
So I had a CGPA of 3.88 out of 4. So anything above 3.4 is considered for a definite merit scholarship. So you get an additional scholarship. So some universities do mention this, but others don't really mention as to how much you need to get. But ideally, it is around anything above a 3.4 is good for a merit-based scholarship.
Right.
Yeah.
Okay.
So that's why study well, guys. And there's no hard and fast rule that you have to get distinction. A first class with a mix of a distinction is also great. Just study and do well. Like get good grades and you're good to go. You'll save a lot of money. So these are the two important things that you have to do. MCOTS actually did the WES evaluation on my behalf. So for everyone who's from MCOTS listening to this, please go to the administrative office and tell them you want to do your WES evaluation. They would do it for you. And and that's a very big advantage. Like no other college does it for their students. Doing it manually, like on your own, is a pain. It's really, really, really hectic. So you're off with one thing. Then you apply aram se, and you go about with your statement of purpose and your CV. And if you submitted prior to your priority deadline, you are often also advised to write a scholarship essay.
Okay.
For example, Boston University made me write one, and so did University of Michigan, Ann Arbor. So they have different requirements for different colleges, but most top-ranked university will expect you to write a scholarship essay. They'll give you a prompt and a word limit, and you basically try to answer them, in that much word limit, and you should be good. I think once you're done with submitting all your documents, your academics, you have a checklist given to you by the university on SOFAs itself. So just go through all of it. Then you just submit it and you wait. You should expect a reply from all universities within 2 months, 2 to 3 months.
Okay.
Yeah. So I got a reply from all the universities that I'd applied to. before I'd graduated, before I'd completed my internship actually. So I was in a
You
big,
exactly knew what is there
yeah,
for you after.
yeah. I had it all figured out before I even got out of undergrad. So yeah, so I think that's why I said like it's very important to plan and start this process way in advance, so you know that this is gonna happen for sure. Like you're gonna have this irrespective of anything. Like nothing could go wrong.
Right.
And yeah, and I think once you get your university admits, then you just make a decision on which university you want to go. So I had it in mind that I always wanted to do, this degree in Boston University itself. So for me, it wasn't a very difficult decision to make. And I did that. And then that's it. Then go about the aftermath of what do I do after I'm done with picking the university.
Right. So we'll
Yeah.
talk about the prospects then.
Yeah.
After an MPH degree, what are the prospects? Like, what are all the available options that you have that you can choose to take up?
Correct. So, I think when you think about prospects in any career, even MPH, you really should think about a short term goal and a long term goal. So, my short term goal after doing an MPH, which I'm hoping the degree would give me, is basically just attain a set of skills and knowledge which would basically, help me address different kinds of community issues. And it will basically make me, skilled from all interpersonal ways. And there could be any professional sector that I could work at. And in terms of a long term goal, I really, really want to take up projects with very big league organizations, like I said, like WHO, UNESCO. I really want to work on real life health problems and health crisis situations. And this is not like solely in a particular country. Like India, for instance, is high rise for tuberculosis. Like it is one of the most thriving countries to have the highest amount of TB patients, people dying from it as well. So, and groundbreaking research on TB, it's still ongoing. It's something that we're still working on from years. Even rheumatoid arthritis is something that we have been working on. So every country that way has some of the other crisis situation. And the course that I am doing in is MPH in epidemiology and biostats. So they are like the two most important pillars in resolving different kinds of health disparities and situations. Without them, you can't at all find a way to, go about a whole protocol and procedure as to how do I solve this health issue. Like you have your doctors, you have your medical practitioners. Take COVID-19, for instance. When COVID happened, the most important people to, control everything and sort everything out were public health practitioners. Without them, we wouldn't have known how many people were affected by it, how is the spread of this disease, and to what extent is it going to go to. You have the numbers, you can predict everything with an MPH degree in epi and biostats before it's even happened. Like you can literally see into the future and you can, basically avoid an entire, epidemic or pandemic that's going to probably consume the entire world, which is what COVID-19 did. And when
Yeah.
you're faced with all these issues, you really, really need to, talk about how am I going to contribute and how am I going to do in terms of, helping the world and try to, prevent this from happening so that the medical practitioners can go and help, all the people who are sick and in need of like, support. So all of these things are very crucial, and I think an MPH practitioner, public health practitioner, is the first line of addressing these issues. So in terms of prospects, I really see myself wanting to do something like this. Like there are so many diseases in the world that keep coming, and and that are still there, ongoing, and I would really want to contribute in resolving those current health disparities and prevent future ones from affecting the world. So that's one thing. Other prospects for people who want to pursue this degree could go in terms of academics as well. A lot of people also take up teaching. They like education. So you can educate people in terms of the different pillars of MPS. There are five main concentrations. And after an MPH degree, you just need a licensing exam for like an education license exam. And then you can work as a professor, an associate professor at universities. You can do, hard-end research at the universities, and you can work on a lot of projects as well. So research is one realm, and then there is data science, which is what I'm looking at to prevent diseases and anticipate them before happening. So that's data science, then there's research, then there's teaching, and a lot of other people who, love clinical still after MPH, probably also do their dental degree in the US. So they do their DDS. Or there are medical professions who who give their USMLE after it, and then they become, practitioners and do their MD. So I have a senior from Boston University who is actually an MBBS doctor, and she's doing her MPH. And and she solely has actually, gone into the realm of research and data science. So she's actually working with the university to resolve big healthcare problems on rheumatoid arthritis and obesity, because it's a very big leading cause in the United States for death. So, there are a lot of things you can do with it. But it really depends on where your interest lies. There are a lot more opportunities out there. You can even work with pharmaceuticals. People who are interested in pharmaceuticals and medications work with pharmaceutical industries to, come up with newer medications, or they even work with the FDA to, come up with new regulations, health policy laws, all of which, help to improve health and make a better working environment and health environment, safe environment for all the people around the world.
Right.
Yeah.
There are an array of things that you could do based on what you like.
Yeah.
And no degree will ever, define a lot of things.
Definitely.
So I'm pretty sure the whole process, especially with internship, was quite stressful. I mean, starting from applying to so many colleges and then eventually, having. So basically, do you have to write SOP for every college, or is it just like one SOP and then that's gone to the all the colleges that you apply for?
So I think it really depends on you as well. I actually did not write the same SOP for every college, because the prompt that was given to me for the colleges that I selected were all different. They expected different questions to be answered, in the SOP prompts. Like you would get like 2 to 3 prompts that you must include in your statement of purpose. It's just a way for them to know who you are. Like they don't know who Palak is. They do not know who Rhea is, but they will get to know Rhea and Palak through their SOPs. So you need to first and foremost be very honest with the answers, because if you lie, they will find out. So don't lie on your SOPs, guys, and just try to be as
Real.
as real and as transparent as possible is what I'd say. You really need to tell them that that this is who I am, and I'm not just a dentist. I'm a lot of other things, and this is why I am doing this, or I want to do this, and this is why I think I would be an asset to your university. Like I would be a perfect fit for the course. Like you need to tell them that why they should pick you. Like what's so special about you? What's unique about you? They just want to know about you, not about oh, like you're a dentist or you have really good grades. No, but like what are you going to do with those grades? What have you done that's impactful to people? Have you influenced a lot of people around you? Because anyone can get good grades, but not everyone can get good grades and have everything else with them. So I think that is important. And to answer your question, every university gives a different approach. You need to make a decision whether you want to draft one SOP and just make changes, to the prompts accordingly, like keep some paragraphs the same and some answer different. Yeah. But I didn't do that. I wrote a different SOP for a different university because, I mean, that's just me. But
and how many universities did you apply to?
So I applied to 7 universities. This is also something that I think people should keep in mind. Don't be cocky and apply to just 2 universities. Like I know it's going to be expensive to apply to a lot of universities because each application form is like over $100. So if when you apply to 7, you have to shell out a lot of money. But don't ever think about the money because if you start thinking about that, you just keep questioning about should I even apply, and you like halfway there. So don't worry about that. Everything comes back. Whatever's given always comes around, and you get it back even more. Like don't worry about that. So just apply, and I think a good number would be anything below 8. You should apply to at least 6 to 8 universities so that you have better odds. And you can't just apply to all top ranked universities. You need to segregate it. So you have target schools, you have dream schools, and you have safe schools. So I applied to like 3 dream schools, 2 target schools, and 2 safe schools. Yeah, and
Wow.
I got into almost all of them. I just didn't get into one, but that's okay. That was my safe school. I got into the one that I wanted to get into, so I was okay with it. Yeah.
So that just means to say that it's just not a very direct way, right? You have to strategize based on a lot of your strengths, put it across in a way that they understand. It's just not like
Yeah.
SOP likhna hai. No, there's a
Nice.
certain way of putting things across. So where did you learn all of these things from? Was all of this networking, or were there some websites that would really help you understand the procedure?
Okay. So I'll tell you that the more, like I said, right, the most important thing is your SOP and your resume. These are the 2 most important things that you really need to think about. So for your SOP, I did not really get, help from the internet. I just spoke to people. Like networking did play a part. Like I spoke to people who were already, in the course. Like I said.
Mm,
So from
mm,
them, I got this information about what they expect you to, write in your SOP. So they just, sort of gave me like prompts
mm,
about what they used, in their SOPs. Like
mm,
they didn't tell me their real life incidents or something like that because an SOP is a very personalized document. You should
mm,
absolutely not share your SOP with anyone because it could be misused. So what you can do is you can talk to people and you can ask them what prompts did they focus on, and then
mm,
you can try to correlate them with real life situations that have happened with you.
mm,
So like what experiences in your life has probably impacted you into doing this way. So like for example, I'm a dentist.
mm,
So most of my SOP was revolving around my life as a dentist, why I wanted to pursue dentistry, why healthcare, why did I pick healthcare in the first place, or what incident from my childhood or adolescence actually triggered me into wanting to do healthcare in the first place. Then it
mm.
just talks. It's like a story. So then you talk about when you're in dental school or when you're in your college, what you
What
did, what
happened?
you learned. Correct. You
Mm,
basically just explaining about your entire journey.
mm,
And then you need to make sure that you approach the point of, why did you pick this course, this program after you've done this in your bachelor's? Like, what made you do it? And why do you think it's a perfect fit? Why do you think this college is something that you want to do this degree in? So, it's like a story. So you start from childhood to like healthcare to like dentistry, dental school, incidences in dental school, then inspiration to why doing this degree, and yeah, and why do it in this university.
mm.
That's about it. Like that's how an SOP for BU at
It's
least. Yeah, that's how it went for Boston University. But most universities have similar prompts. Like it goes this way. I think if you have these points in mind, you're gonna write a fantastic SOP. Like you won't be lost. I took
and
like I think I wrote like 20 drafts before I finally got it. Like 20 drafts before I finally understood what they want me to say. And I kid you not, like I was giving up every second day. I was just burning out and I was like, I can't do this. I've written like 5 drafts already. It's been 5 hours, so it's a very, very stressful process. I'm going to say that as well. But just keep your cool, be patient, don't give up. Like, don't
So
at all.
how much time should you ideally allocate for this? I mean, 20 drafts, and I'm pretty sure you might have asked people to read about
Yeah.
the
Sorry.
entire.
Yeah, sorry.
Um, that will
20
get cut. Yeah.
Yeah.
So you actually wrote 20 drafts, and then I'm sure you might have asked people to read the draft or just verify things for you. So how much time should a person allocate for the SOP? That's,
Um,
idealistic.
so I don't think there's a fixed timeline, or you cannot allot a time to an SOP because it's an ongoing process. So it took me 3 months to finalize my SOP for each university. Not like 3 months per university. It's just I kept writing SOPs for each university simultaneously. Like when I was done with, say, half of one, I would start with another one
Okay.
because it was a similar prompt. So, it's not that different. But I would just change a few things, a different experience probably that's, answering their question for that university. So I think when you're applying to so many colleges such as I did, you need to write an SOP simultaneously so that by the end of 3 to 4 months, you
You
have
have
a final
everything.
draft ready. Yeah. And like I said, you apply for the course 1 year in advance. So you by doing that, you're basically allocating yourself enough time to have everything covered so you don't miss out on anything.
Yeah.
So I had the leverage of using 3 months to, write a proper, nice, perfect SOP. But some people realize very late that they want to do this degree, and then they are, left with very limited time. So then they have to write a very rushed SOP. Everything is very poorly handled and poorly this thing. So that I think is one reason where people fail in, getting an admit because they're rushing into this a lot. So I feel like this is a process that you need to allocate a
Give
lot of
time.
time to. Yeah. You cannot be like, Acha, now I'll write an SOP in 1 week, to ho jayega. It's not like that. It's not a viva you're studying for. Trust me.
So my
Yeah.
last and final very important question would be that after this entire journey, I'm sure that there are certain things that you've understood that are the highlight of your CV or your
Yeah.
resume, right?
Yeah.
And that's probably the reason that you got into. So
Yeah.
if you had to tell me, say I'm just starting my BDS right now, and there are these 5 things that are a must do
Yeah.
if you want to be where you are today. So what are these things going to be that
Um,
I must have on my resume?
so the 5 things that I think are very important for a person who is just starting their undergrad, if they want to pursue this degree, would be definitely have a lot of volunteering experience because no experience is going to go to waste. Okay, when you volunteer, it could be as small as just volunteering for a blood donation drive. Go for it because it shows everything that you volunteer for shows some of the other skill that you hone. Like going for a blood donation drive would just showcase that you care or you have empathy towards wanting to contribute to a cause by giving blood. It could save another person's life. So for you it would be like, I'm just going and donating blood, it's not a big deal. But for the people who are reading your SOP or your resume, the administrators would probably be like, okay, this person went and donated blood, and this is probably why this person did it. This showcases that this person has this kind of emotion or skill or reasoning behind why they did what they did. So I would just suggest that no skill or no job goes unnoticed. They validate everything that you do. Every kind of volunteering is really welcome.
Important.
Yeah, so get as much as volunteering experience as you can. That's one thing. uh, your grades really do matter. You will have a minimum GPA that you have to meet because they have mandatory requirements. So for top rank universities, you need to have a minimum of 3.4.
Okay.
Like without that, they will just reject your application then and there. So your grades matter. The volunteering experience really matters. Since we're all dentists, we basically have clinical experience, which is something that is unique and they appreciate. So you could get additional experience like I did by working in a private practice, if possible. Attend a lot of conferences, get research papers published. They love that, you have publications and that you're actually interested in doing something, you're not doing it for the sake of it. Like it gives them an idea that, this person, wants to contribute. Like they are actually interested in doing it. They will learn and they will help us also make a big difference. Like they'll be an asset, not a liability to us. So definitely do research, but do it if it's something that you really like. That's one thing that I would also tell people. Don't take up something just because someone else has done it. Take it up if you like it, if you're passionate about it, because once you get into any field, you're going to be stuck with it. Like you're going to have to like make a career out of that. Like I'm talking about a master's degree. After an undergrad, you can definitely still go and switch, and you can venture other options. But once you get into like a master's degree, you've learned a lot. You've probably decided that you want to do this. So think about what you want to do and then take this step. Because once you're in it, you're invested in it. It's a lot of investment that you have to make. So these are the things that I think would look really good on your resume because they'll showcase a lot of skills. So you can even do extracurriculars like I did script writing work for MediStudy Go. I was the faculty head for Rotaract Club of Medicrew in Mangalore. Okay, and I organized a lot of healthcare events for them actually. So these are extracurricular activities. I was also part of the cultural team in the editorial board of college. So I was in charge for a few people in the cultural section of the magazine. So these things are also very well appreciated by them. So you should definitely have these things out there.
So this will be the order of things, right? You start with volunteering and then go up to extracurriculars.
No, the order for it would be you write a summary about yourself. So there are at least 6 headings that you need to involve in your resume, and it should be less than 2 pages. Like 2 pages is the max. Do not make a resume that's longer than that. They won't read it. So write a summary, like maybe a 1 or 2 line about yourself and what your goals are. Following that, you should write about your highest degree of qualification, which for me was my bachelor's in dental surgery. And just beside that, you can maybe mention how much your CGPA was, like in the entirety of it. After that, you write about your experience in terms of work. So for me, it was internship. So I wrote about internship. I wrote about my internship at the dental clinic that I practiced in. And then I even wrote about MediStudy Go because I had a script writing job by them. I wrote about faculty head of Rotaract Club of Medical because that was also assigned as a job with a letter and everything. So all these things come under experience, professional experience. Following that, you can write about your research if you've done any. You can write about any ongoing research, but don't write more than 2 or 3. And it would be preferred if you write about a publication if you've gotten, because that holds a lot more weightage as opposed to an ongoing research. A publication is always better. So you can write that. After that, you can just mention a bit about your extracurriculars and volunteering experience. And then at the end, you can maybe write about your achievements. So I had mentioned about my awards that I had won for scientific paper and poster presentations at various conferences. So I made a separate section for that as well. So if you're someone who's done that, and it's definitely valid, so you should definitely write it in your awards and achievement section. And I think that's it. These are the 6 headings that you should have. You can even maybe add a small section of skills that you hone. So they have an idea that you hone like interpersonal skills, communication skills, leadership skills, teamwork skills. If you have all of these, it's reflecting on your resume by what else you've written. So write relevant skills on your resume. This is what makes a good academic resume, is what I'd say. Yeah.
So that's all the questions that I had. I'm really thankful that you chose to answer all of these things today.
Thank you.
So thank you so much, Dr. Ria. It was really insightful getting to know you all over again. Getting back to the journey and then realizing that you've come so far in such a little time is absolutely something that I admire. And I really hope that this degree doesn't just be another degree for you, but really changes the perspective of how you evolve as a person, and your journey inspires so many of other people to explore different paths. So
Thank
thank you so
you.
much.
Thank you for having me do this session. Actually, I'm glad that I got this opportunity of explaining my entire process and journey to getting to an MPH degree at BU.
And for everybody who wants to connect with her, I will put up her LinkedIn profile in the description box, and you can message her. She's spoken a lot about networking. Now go network with her, because she will definitely share not just her experiences, but the experiences of others, which combined with her experience can actually change your perspective towards this entire field. I mean, you don't have to restrict yourself to clinical dentistry, and she will really help you understand that and shift your mindset, which is the first step to even get into where she is today.
That's right.
So um, just connect with her, and I'm sure she'll share her posts on LinkedIn, and we can get to know about what exactly happened at BU.
Yes, for sure. Stay tuned for everything that happens at BU in the MPH degree. Yes.
Yes. Thank you.
All
Thank you
right.
so
Thank you so
much.
much.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.